Hello, I'm Jason Howland. Welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. Irregular periods, interrupted sleep, mood swings, and hot flashes. They're all potential symptoms of menopause, something every woman experiences at a certain point in their lifetime. And here to tell us more about today's topic is Linda McClintock. She is a certified family nurse practitioner from Mayo Clinic Health System. Linda, thanks for joining us today on Speaking of Health.
Thank you, Jason, for having me. This is a subject that's near and dear to my heart.
Well, we are talking about menopause. First of all, for those who don't know, what exactly is menopause?
Menopause is the permanent end of fertility and menstruation. You are considered in menopause once you have not had your period for 12 months, so you have to kind of look at it retrospectively. It's not a medical illness. I consider it a natural stage of life. It's a life transition that all women have to deal with at some point or another. And it occurs, average age about 51. Most women go through menopause between the ages of 45 and 55.
You mentioned it's not a medical illness, but menopause definitely does come with some medical symptoms.
Yes, there are quite a few symptoms women may have when they go through menopause, and I feel if women are able to learn what to expect, these symptoms will be more manageable then, such as irregular periods, decreased fertility, vaginal dryness, hot flashes, sleep disturbances, mood swings, increase in abdominal fat, thinning of hair, and loss of breast fullness.
One of those symptoms that you mentioned was hot flashes. We hear a lot about that associated with menopause. What exactly is a hot flash?
They're not quite sure what the mechanism is in hot flashes. However, they do know it has something to do with the temperature control center of the brain. And decreasing estrogen levels seem to affect that part of the brain, and women can spike a temperature. They get a sudden onset of feeling very warm, and what happens then is blood vessels dilate and women start to sweat and feel extremely hot.
And it's not just that they're feeling hot, but their actual body temperature is going up?
Yes, in some women they can spike a fever.
So what exactly causes menopause to happen in women?
Well, as you're approaching your late 30s, the ovaries start to decrease in their function. They start making less estrogen and progesterone. There's fewer eggs ripening every month. Changes become more pronounced in our 40s. There can be changes in our menstrual period. We might skip a couple months. 1 month might be heavy, another month might be light. And this is something called the perimenopausal time, which some women confuse with menopause. The perimenopausal time can have the same symptoms as menopause, except you're still having your period. And that can last anywhere from 6 months to 10 years before you actually hit menopause and you no longer get your menses.
So you could actually be going through perimenopause for a fairly extended period of time then?
Correct. That's correct.
So are there other causes rather than just the normal hormonal changes as women age that can cause menopause?
Yes. Some women, because of medical reasons, have had a hysterectomy and had their ovaries removed, and that puts you into immediate menopause. There are some women who have to have chemotherapy and radiation that can affect the ovaries as well. And some women, particularly before the age of 40, can go into something called premature ovarian failure, and that will put them into menopause as well.
So basically it all comes down to the ovaries then, right?
That's correct.
So because menopause is not an actual medical illness, but rather something that every woman has to go through, you don't want to treat it like it's a medical illness, but however you want to treat the symptoms. So what are some of the most common treatments available for menopause?
I tell women if symptoms are disruptive, there are treatments available to help manage them, such as hormone therapy. Hormone replacement therapy used to be very popular until around 2002 when a study came out showing that it increased your risk of heart attack, stroke, and breast cancer. At that point, millions of women went off hormone replacement therapy, and what that did with the breast cancer rate is it decreased after that. However, hormone therapy still has a place in our treatment regimen. They find that hormone therapy is safe up to 4 years after you go through menopause. And after that, the risks outweigh the benefits, and then we like to take women off of that. If it's only hot flashes that are bothering you, then we recommend low-dose antidepressants, which I've been very successful in treating hot flashes with. There's also an anti-seizure medicine called Neurontin, and there is an off-label use of that for hot flashes as well. And then there's a blood pressure pill, clonidine, in very low doses that can decrease the incidence of hot flashes.
You know, all those medications that you talked about, they're actually for other ailments, but the results of them helps with hot flashes.
Yes, they are, and they don't know quite how they help. They just know that they do help some women with their hot flashes.
I'm assuming it has something to do with the brain, right?
That's correct. There are also other treatments for going through menopause because women are at risk of brittle bones, something called osteoporosis. There is something called biphosphonates that strengthen the bones, and there's also something called selective estrogen receptor modulators, which also decreases a woman's risk of bone fracture. For women who just have vaginal dryness, there's some vaginal cream that works very well for that.
The biphosphonates that you talked about, is that a pill that you take or something else?
Yes, that's a pill that you take, and they find it greatly decreases a woman's risk of fractures after menopause.
Linda, you mentioned osteoporosis as one of the medical conditions that can increase after menopause. Are there others too?
Yes, there are, such as cardiovascular disease increases after menopause. This means that a woman's risk of heart attack and stroke increases. And then we also discussed osteoporosis. There's also urinary incontinence as well. And what's happening is the lack of estrogen to the vaginal tissues can thin out and dry out the vaginal walls. However, it can also thin out the walls of the urethra where the urine passes through to get out of the body. And that increases the risk of urinary incontinence. The first sign is usually the woman coughs or sneezes and a little bit of urine leaks out. Women also gain weight after menopause, but they're not sure if that is lack of estrogen or just decreased metabolism.
So at what point should a woman see her provider?
The woman should be scheduling regular visits with her provider in the period leading up to menopause as well as the period after for preventative health. I recommend all women have their cholesterol checked. And even if they've had normal cholesterol before menopause, sometimes the cholesterol levels can change after menopause. If you've skipped your period and aren't sure if you've started menopause, keep in mind that you might be pregnant. And I have had patients who have gotten pregnant in their late 40s, which was a surprise. Once you reach menopause and you haven't had your period for 12 months, any vaginal bleeding you have after that is definitely abnormal and you need to seek medical care.
Well, how about some tried and true methods? Do you have any tried and true methods for reducing or preventing the effects of menopause?
Yes, there are a few things that women can do to decrease the effects of menopause. One is regular exercise, dressing in layers, so you can take a few layers off when the hot flash hits. And then you try to pinpoint a trigger to it. Some women find that if they drink hot beverages, that makes their hot flashes worse. Also, spicy foods, alcohol, caffeine can also make their hot flashes worse. You want to avoid warm rooms and you want to avoid hot weather because, of course, hot flashes are much worse when you're spiking a fever in those situations.
So those methods that you talked about, those are for helping with hot flashes, but what about some of the other symptoms?
Well, for vaginal dryness and discomfort, there are some very good over-the-counter water-based lubricants that women can use. Plus, we encourage women to stay sexually active.
What about Kegel exercises? I've heard about that before. What is that?
Yes, Kegel exercises are exercising the muscles on the pelvic floor. And I found that that is very helpful for women, particularly when they have urinary incontinence, because what it does is it strengthens that muscle that holds our urine in. And I have successfully treated women for urinary incontinence just by teaching them the Kegel exercises.
And one of the other symptoms that we talked about earlier was interrupted sleep. So what are some helpful hints for for women who may have interrupted sleep from menopause?
Well, we recommend no caffeine use in the afternoon or the evening, plus exercise. Daily exercise can make you exhausted, so you're going to sleep quite well then.
I've also heard of some relaxation techniques. What exactly is that, and how does that help?
Yes, relaxation techniques such as meditation and deep breathing have been found to decrease the symptoms of menopause.
And how about diet? Are there things that women can eat that can help them get through menopause?
Yes, not only help them get through menopause, but also decrease their cardiovascular risk. We encourage women to eat lots of fruits and vegetables and whole grains. You need to limit your amount of saturated fat and sugars, and possibly add calcium supplements.
Linda, how about alternative medicine for treating menopause? I've heard a little bit about that. Is there validity to that?
Yes, there is. I've had some women successfully treat themselves with alternative medicine. There's something called phytoestrogens, which are plant estrogens, and one of those would be soy. And some women find if they increase their intake of soy, that helps modulate the symptoms of menopause. There's also vitamin E, which can decrease the degree of hot flashes. And then there's herbal medicine called black cohosh that also helps with the symptoms of menopause. Some women find if they do yoga, that can also help them as well.
Well, I have one last question for you. As a provider, what sort of advice do you have for women just overall in coping with the menopausal process, I guess you'd call it?
All right. Menopause does cause mood swings in some women. However, they have proven that menopause does not cause severe psychiatric problems. They are unsure if the decreased estrogen in menopause is a cause for the mood swings or there's other life changes, such as your kids are out of the house. It's an empty nest syndrome. In this economy, maybe your kids move back in, and that also causes stress. You're taking care of your aging parents, which can also cause a lot of stress. And women just really need to take good care of themselves in menopause. Get lots of sleep, try to decrease your stress levels, and try to really take care of yourself.
All right, very good. Great words of advice. Well, unfortunately, that's all the time we have. Thank you to our guest today, Linda McClintock, Certified Family Nurse Practitioner from Mayo Clinic Health System. It's been very beneficial having you here. Thank you.
Thank you for having me, Jason.
Have a great day, everyone, and be healthy.